okay with you?
All right, now you stay that way.
And you stay relaxed.
Now, what I started to say before is that this is your opportunity to compound the seal. In other words, add a seal on the seal on the seal. So if anybody else here has a bright idea that they'd like to add to this, this is your opportunity. You can either have Dr. Epperson add it, or one of you can come up and add it yourselves, as you prefer.
Good.
Yes?
Dr. Epperson, could you add also that he wouldn't be able to visualize himself doing this?
Now, neither, in the future, in any speech that you may be asked to perform, you will not be able to see yourself doing them. If we should ask you to visualize anything, you will not be able to do it, neither will be able to see yourself doing these things. Is that acceptable with you? Right? Is that all right with you? You can accept that? You understand what we mean? All right, Pat?
And we add the visual, the sight of Dave will immediately put him into a natural sleep state.
Well, then you would keep Dave from demonstrating what he wants to do at this point. You probably could do that if you wanted to do something else. But for the purpose of the demonstration now, that wouldn't work.
He was stealing off from the memory of Dave working on him this afternoon, prior to just now.
Yeah. Yes. Do you want to add that? You want to add that he won't recall as Dave having been the operator? Is that your thought?
He will not remember that...
No, we'll bring that back.
He will not remember that Dave had worked on him this afternoon.
All right, Pat, I think that'll be acceptable. You want it, that you will not be able to remember that Dave Ellman worked on you this afternoon at all, and you will forget all the methods in which he used, and you will forget him working on you this afternoon. Let's just erase that, Pat, for the time being.
He has said no to that. You see your patient's ability to reject a suggestion
just stay
anywhere.
relaxed, and we won't ask you to do anything preposterous like that.
All right, hold it just a minute.
I'm going to have the doctor suggestion that Mr. Ellman will not be able to put him to sleep either directly in speaking with him or indirectly through anyone else in the room.
All right, now Mr. Ellman might try to put you in the stage of relaxation through other people. Is that what you mean?
Yes.
Some intermediary.
Yeah.
And should he try to do that, you will not accept that. He will not let that produce this stage of relaxation. If you use 1, 2, 3, or 4 persons as intermediaries, you will not accept that suggestion whatsoever. Pat, is that all right with you? You accept that? That won't bother you in the least. All right?
Now, a very important point here is this. In this particular case, several suggestions have been given to the subject. He could very well be confused. Probably many of us are confused at this point. If we're confused, we can't follow through a suggestion. And if you want the seal to stick, be sure that he's not confused. So will you review what you expect of the patient?
Do you understand all these suggestions, Pat? First,
I think so.
all of them. First,
You have forget everything that you have told me. I will not be able to visualize you.
right.
Nor your manner of speaking,
That's right.
nor the methods or techniques that you use.
That's right.
I did not want Mr. Ellman did not want to lose the work that he has done with me this afternoon.
That's very good. That's very good. You can't ask him to forget that.
Should Mr. Ellman try to relax me, I will not relax nor go to sleep.
All right.
Should he try to relax me through intermediaries, I will not relax.
Thank you.
Before
All right. That's very good, Pat. You have them all down very well. All those are acceptable to you.
yes.
Yes?
I would like to have you add this suggestion to him that emphasize on his mind that he's well aware of all this Mr. Ellman has done for him this afternoon and all, but for the purpose of the students to bring out true teaching of this breaking the seal, he would remember that he wouldn't help Mr. Ellman in any way.
He just told us that himself, though.
No. He told you something else. He told you that he didn't care to accept the suggestion that he would forget that Dave helped him. That doctor is trying to say, that for him not to feel that because Mr. Ellman helped him, that he in turn will help Mr. Ellman. He is to resist Mr. Ellman all the way. Isn't that your point?
No, we're not trying to be antagonistic to Mr. Ellman. You understand that completely. We're just doing this for an experiment here.
And you want his complete cooperation?
Yeah, we want your complete cooperation. We realize how much he's helped you this afternoon, but don't let that interfere with this, because we want that to go on and to last. But don't let that interfere with this experiment this afternoon whatsoever.
No one but you can put him into the state.
All right. That's right. And no one but myself can put you back in this state whatsoever, but you will forget anything or any methods that I have used to put you in this state, and you will also forget me, will not be able to see me whatsoever. My face will not come before you when asked to come before you whatsoever. Is all that acceptable, Pat?
Yes.
All right, you can open your eyes and you'll feel fine. You'll feel fine.
How do you feel? Good. Would somebody be good enough to pull Dave for me?
Well, I've got a seal here that is leaving. Well, let's see whether or not the seal is. Now, let's first find out if the seal is there. You want to see if you can get eye closure? Just try, huh? Won't happen, huh?
No.
All right, that's fine. Pat, would you put your finger up like this, please? Now, I want to see if you can make your finger as rigid as I make mine. I'm going to count to 3, and you make your finger as rigid as I make mine. Now, 1, so rigid it won't move. 2, so rigid neither one of us can bend it. 3, it's like steel. Now when we try to bend it, it won't bend at all. Try, and you'll find it just won't bend. That's right. Now watch. Now I'm going to count to 3 again, and this time, as our fingers start to bend, as my finger starts to bend, your finger will start to bend. And as your finger starts to bend, your eyes will close as the finger bends. Now watch. 1, and the fingers start to bend. 2, and watch how it bends now. Starting to bend, let it bend. Let it bend. That's coming down now. That's right. Watch how the eyes close right with it. That's right. Now, 3, and watch how the eyes close. That's right. That's right. Let it close. That's right. Let the finger come down and let his eyes will be locked and sealed. That's right. Now they're sealed. Now they're locked completely, and you just can't open them at all. They're just completely locked, and the seal is broken. Completely broken, completely broken. Just can't. The seal isn't there at all, and those eyes just won't stay open at all. Now you make the numbers disappear, and you feel so good. All those seals will be gone. Make the numbers disappear. That's right. Make the numbers go. Completely gone now. Numbers gone. That's right. Notice how good you feel as those numbers disappear. That's right. They all gone now? All right, they will go now. Just make that finger bend all the way in and all that. Oh, that's right. Now they're gone. Now that feel better, huh? All seals gone now, and any seal ever has been given will never be effective. Now make the numbers disappear, and they're gone already. Right? Gone completely. And notice how good you feel as a result. Now, Pat, I want you to listen to me very carefully. All seals of whatever kind are completely gone. But the suggestion I want you to hold on to the strongest of all. I want you to know what caused you to have trouble at your examinations. I want you to know that you won't have that trouble at examinations anymore. Because any time you see a tough problem, what are you going to say to yourself?
Question 8.
Question 8 in algebra, right? And you know that because of that, you just won't have that panic. But instead, you'll go in there with an absolute feeling of confidence at every exam that you have. And that'll be true from now on, all through your lifetime. All right, now when I have you open your eyes, you're going to feel so wonderful, and you'll be able to reach this state anytime you want to. Now open your eyes, notice how good you feel. Now, rather than showing that that was a weakness of Pat, that was a strength of Pat, because I know whoever sealed him off must have done a magnificent job, and he fought awfully hard. But now let me tell you why I was able to break that seal. not because his mind is weak, but because his mind is strong. Let me show you what I mean. No one in the world can close another person's mind so that it is shut entirely. You close one door with a seal, there are a million other entrances and exits. And all I did was to go around to another entrance, another exit. While you people have been struggling so hard to make a seal in 100 doors, you would still leave 1 million or 2 million doors open. And if that technique hadn't worked, I'd have used another one, and another one, and another one. For example, does anyone here think that they could take an intelligent person's mind and lock it up tight like a clam? You couldn't do that. You might lock it in 1,000 different directions, but you can't possibly lock it in all. The mind is infinite. It isn't just a little thing, a little thing that you can just lock up like you can lock that cigarette case. You open it and you lock it. And you can't get into it now until you go in by its right entrance. But you take the human mind. He's got 2 million entrances, 2 million exits. So you might have sealed off some of those exits, but you left a whale of a lot of them unguarded, and so does everybody who uses the seal. Let me show you another technique for breaking the seal. Start just twisting that in your hand like that. Will you, please? I'm going to count to 3, and you'll find that you can't stop twisting that at the count of 3, but it just keeps on. 1, 2, 3, and now you'll find it won't stop. You try to stop, the faster it goes. Now watch that. Try to stop. The harder you stop, the faster it goes. Now, all I have to do is now close your eyes and sleep. Fast and sound asleep. And he would be fast and sound asleep, and we have the same technique as the top trick. And notice how deeply he goes instantaneously. So you see, there are so many ways. There are so many ways to break that seal. You can't think of the number of ways that I would be able to think out in case I encountered a difficult seal. Now, this is about as tough a seal as you ever encountered, because you fellows have done a good job. I don't know who did it, but whoever did it really latched on to some tough ones. I think there was a time seal in there, wasn't there? Was I right on that there was a time seal?
What are you asking for?
Well, I mean, after all, I broke the seal. There's no reason why you can't tell me now. All right, I'll listen to it on my tape. I got it in my system. I've never listened to one of these things, incidentally. I've never listened to one of these things. I've never found out how the doctors seal them off. I've never used that knowledge. You can believe that when I say it, because snapped right out of it, huh? Good, that's all right. Brought yourself right out.
I tried another method a while ago, though, back here. I tried the stiff arm.
You notice that thing is still going. All right, Pat, let me take you out of it right. Close your eyes. I want to have you open your eyes now. Those suggestions about your examinations and all that, they're going to remain. And all the suggestions for your good are going to remain. But all the others will be negated, and you'll feel like $1 million, and you can reach this state anytime you want to. All right, open your eyes. Notice how good you feel. All right, you write to your dad and tell him that... Okay? All right, let's call it quits for the day, huh?
No.
Oh, wait.
My note first.
Your note first. All right. What is the note? Next lesson, this final one. Please bring a lot of people who take suggestion well. Yes, do that, won't you? That's very important, because if you don't, we don't have a good session, and we'd like to make our number 10 a sort of a, well, you know, a sign-off, so that we can always feel that you enjoyed that more than any other. Gentlemen, every time we come to a number 10 session, I feel like the devil. I mean, I feel, instead of feeling good that the classes are over, I feel a little bit sick inside that the classes are coming to a close. I'll tell you why. I realize, fully as well perhaps as any man living, that hypnosis has never been given the chance it should be given in medicine and its allied branches. We seek to teach more about this subject than is taught anywhere else in the world.
And during the past 10 years, we've been completely successful in that effort to teach more than anyone else in the world. But still we feel that 10 sessions are woefully inadequate. It is my feeling that hypnosis is a serious scientific study and merits the scientific attention of every man of medicine, no matter what branch of medicine he's in. I have the feeling that someday, perhaps, we will have hypnosis properly established in medicine so that the student may learn hypnosis in a 3-year course. For example, what I showed you last week, the rest of the world doesn't know that's possible. And that what my allegations are concerning that phenomenal state are entirely true. First time, you'll miss with it. Second time, you might miss with it. But about the 3rd or 4th time you try it, you'll be successful, and when you are, you have the nicest phase of hypnosis in all the world. I feel that the state we worked with last week deserves the most intensive research of all hypnosis. I am so convinced that when this state is learned so that doctors can get it practically every time they try for it, this is the preferred state with which to work. Now, you have all the other states with which to work. You could work with a light state. And you know how successful you were the first 6 weeks, and we were just teaching you how to work with a light state. Then we got into deeper states, and you can work with somnambulism, and you can work with a coma, and you can work with the various other phases that we have taught you. But the preferred state of all, in my estimation, is the one that you saw last week. How can you make doctors see that that is the important thing of this course, that we build up and build up and build up, and finally we hope that when you see what we consider the acme of perfection in hypnosis, that it is then that you start using that state too. How many of you tried it during the past 2 weeks? And how many of you succeeded with it? You got it. How did you like it, Doctor? Isn't it an amazing state? Now, the rest of you missed. Does that mean that you're going to continue to miss? No. There are certain things we seek to do at the 10th session. First, to let you know that while we teach more, we feel your studies are not over. We feel that you should go further with the study of hypnosis, that you should study and study and study and make this thing finally sing the song that it's so capable of singing. I don't want you to think that you stop studying because I quit teaching at this point and then we go back and start another class over again. Could I teach you more about hypnosis? Undoubtedly I could. Yes, but the law of economics is one which dictates that when you've carried a man this far in hypnosis, you got to start all over and carry another bunch of men this far in hypnosis so that eventually we can get enough of you enthusiasts to make what we have dreamed of all these years come true. The scientific use of hypnosis instead of the biased, prejudiced use of people who have investigated the state from the outside in and never thought of investigating it from the inside out. Believe me, so eagerly have I sought the introduction into medicine of hypnosis on a scientific level that when I see doctors using it on a non-scientific level, I get a feeling of, gee, 10 years of work for what? We've got close to 2,000 doctors who have taken this course. Perhaps there's more, I don't know, but there's at least 2,000 of them. 2,000 is a small drop in the bucket compared to the number of medical men there are in this country. And we haven't gone far enough with hypnosis, gentlemen. This course hasn't gone far enough with hypnosis. I am not satisfied that we are doing the job of which we're capable. And consequently, each semester, I seek to add, to improve, to polish. And that's why I say to every one of you that if we ever teach in St. Louis again, this much I want you to know, that every one of you can come back to class again and again and again and again, just like you have seen other old students doing. You'll find that every old student who comes back will tell you that he learns more by coming back. Why? Because hypnosis is an odd thing. In one class you're able to show certain things, and then in another class you're able to show other things, perhaps in another way. Or perhaps we've learned a better way to show, or to bring home the point, so that a point which just sort of hardly seemed pointed, all of a sudden comes clear, and you see the importance with which I, as a teacher, regard that point. The men who really know hypnosis are the men who year after year after year better themselves in its knowledge. Somebody was telling me last week or 2 weeks ago when I was here about a very beautiful thing that Dr. Millikan did long before he met me. I think it was you was telling me, wasn't it, Doctor?
I told you so.
Yeah. Now, remember, I did not teach Dr. Millikan hypnosis. You heard me make that statement. But here is a man who, like me, has been studying it for years and years and years and years. And where do you find him today? Right in the second row there. That's what I mean by if you learn to love this subject, you will study it from now till the end of your days and will always find it a fascinating subject. I want you to come back to class. We hope to have further classes in the St. Louis area, and when we do, come back to class again and again and again until you have absorbed these subjects, absorb these various topics, and know them. It doesn't cost you a penny. It doesn't cost an old student a penny to come back to class. We invite you so cordially, you just have no idea how happy we are to see the signs that a man is paying attention to this subject and learning it better every day. It's the ones who come back who become the adepts. Remember that. Now, we always take the first part of today's session for a review. And here's the basis on which we do this review. The first thing I do is to go around the class and find out how you are presently doing with hypnosis. Now, we know that there are men who are doing very good work in this class. We also know that there are men who, because of the fact that, they approached the subject with a great deal of skepticism, they were pretty cynical about the whole phase of hypnosis, and it was only because they heard somebody say that, well, that man Ellman knows what he's talking about, and if you're going to study hypnosis, why don't you go and see what he has to offer? That you came here in the first place, but you didn't start practicing with the others. And so there'll be some who are behind the others, and some who are doing very, very well. I want you to grade yourself very honestly, because I want you to grade yourself again a year from now, and see how, as you work with hypnosis more and more and more, how adept you become in the years ahead. The same men who graded themselves low last year, you might find that this year they're grading themselves a lot higher. Now, how do I want you to grade yourself? On this basis, if a patient came into your office on whom you wanted to use hypnosis, how successful are you in your attempts? That's how I want you to grade yourself. Then, your ability to put into use the knowledge presented in class. On those two things, I want you to grade yourself. Let's start from scratch, and let's find out if you were to base your mark on your ability to absorb the knowledge, and secondly, on your ability to use the knowledge, where would you put your mark, Doctor? I'm going to ask you as the first one.
A plus, except on kids.
A plus except on kids. And where would you grade yourself with kids?
Flunk.
Flunk. Oh, that's honest. You know what I mean? Because you'll find another man now who'll say A1 with kids, but flunked on the adults. How would you grade yourself, Doctor?
Well, on absorbing it, I would give myself a passing grade. But on applying it, I think I would flunk.
Why is that?
Well, I think it's because I don't have the I don't have the practice to apply most of this material.
You're in what field?
Thoracic surgery and surgery. It's not easily done. Plus the fact that this isn't time, I guess.
If you're doing surgery, and there is quite a bit of it, I should imagine that you would find it very useful, both preoperatively and postoperatively, wouldn't you?
Well,
I mean without
as far
losing any
as anesthesia in surgery, I don't give anesthesias.
You just do the surgery.
Just do the surgery. I don't even give spinals.
Mm-hmm.
So even that preoperative preparation, I'm in a sense not responsible for.
I see.
But possibly there has been a little bit of laziness on my part, and I'll concede that readily.
But you do feel that you're absorbing the knowledge.
Yes, I feel I've absorbed it, and I feel that with the aid of the tape, that someday I hope to go back to it. And I figure that this time has been well spent. I don't begrudge the time I spent with this at all.
Well, the main thing is I want you to be able to use it when you want to use it, you know? You might, like myself, decide that there are only specified times when I want to use hypnosis. I might be called into a doctor's office who expects me to hypnotize the patient for him. Expects me to work with hypnosis. And if I feel that hypnosis is not indicated there, that I'm not going to get any place by hypnosis, but that I'd get just as far by just sitting down and talking to the man, I won't even use hypnosis. I mean, I want you to know that I'm that way too, in that respect. It's only when I feel that I am going to accomplish something that I cannot accomplish by an ordinary conversation that I will use the hypnosis.
Incidentally, there are small phases of it that I've used. I don't believe that, don't get the impression I haven't used any of it.
Oh, I know that.
I've used some of it, but as a total, I'd give myself 20 more.
So I want to go back to back to you, Doctor. Why do you suppose you failed with the kids?
I don't know. I just can't get their attention long enough really good, I guess.
Well,
Can't appeal to their imagination or something.
I imagine that you have a friendly enough face. I mean, we go by that when we know.
I get along fine with kids.
I know you do. I know you do. You cannot get them to play a game for you. Well, that's odd. That's odd. I don't know what the answer to it is because.
I'm talking about deeper stage. I'm not talking about life.
Well, you get the deeper stage with kids. You don't have to go for the deeper stage with kids. If they play the game, they've got the deep stage. I'll show it to you this afternoon. I'll show it to you.
Maybe the signs are
Signs are no different.
same as adults.
Same as the adult. Doctor, where would you grade yourself?
Well, on the OB patients and minor surgical procedures, I'd say about 85%. On children over the age of 6, okay, but between 3 and 6, I can't do any good at all.
You know?
Except for superficial things like a shot to make it a little easier for them and things like that, but that's all. And I think part of the explanation for his trouble and mine too is the parents, in a lot of cases, between the ages of 3 and 6, they don't encourage the kids to go along with you on this. They've given the child the idea that you come in, get your shot, and that's it, or get this done, and you take it.
Do you get the parents out of the room when you're working with the kids?
No.
Oh, well then if you don't get the parents out of the room, Doctor, you will never be successful with hypnosis.
Well, I can...
Not with kids, I mean.
Well, yeah, the children over the age of 6, though, with the parents in there, I can still go ahead and do on it.
I think that your big problem, that you are putting a problem in front of yourself. When you have the parent in the room, that parent can always look at mama or daddy for protection. Whereas when they rely on you and you become the father figure, they know that the doctor's not going to do them any harm, and they then put their complete trust in you. But if they've got a preferred figure, we're on the side, you're not the father figure, and therefore they say, hey, Mom, do I have to do it? You know? Well, now, you just be a good child, do what the doctor says, and